The individual opinions of previous TIF procedure patients presented in this video do not reflect the opinions of Endogastric Solutions, Inc. and should not be considered as medical advice. Always ask your doctor about all treatment options, as well as their risks and benefits. Only your doctor can determine whether the TIF procedure is appropriate for your situation. While clinical studies support the effectiveness of TIF, transoral incisionless fundoplication, in treating chronic GERD, gastroesophageal reflux disease, individual results may vary. There are no guarantees of successful outcome. The TIF procedure may not be appropriate for every individual, and it may not be applicable to your condition.
Hi, my name is Lawrence Wright, and I live in Olathe, Kansas, and I've suffered from acid reflux for over 20 years. My earliest memory is being in high school. I had a bottle of Tums in my locker, probably a bottle a week, and eventually I ended up on something stronger, which was proton pump inhibitors, which I was on for well over 10 years prior to my surgery. I've been in law enforcement for over 10 years, and having the acid reflux and the equipment we wear and the activities that we do, duty belt, bulletproof vest, it real constricting and caused even more issues with my acid reflux. So over time I found that I needed more and more medication to help keep that down.
I'm Lawrence's wife, Teresa. We have a 16-year-old son, Christopher. And I've struggled also with Lawrence's condition, as it's hard to plan dinners here at home. It's hard to go out to dinner and find places that we can all eat at with his acid reflux. And as his wife, it's hard to watch him as he struggled going through these problems. I felt pretty comfortable about Larry going in for this procedure. The doctor gave us a lot of good information. We learned a lot just looking at the website, and especially whenever I compared it to some of the other procedures that are out there. There's a lot more downtime, a lot more time off work, a lot more side effects after some of the other procedures. This procedure was pretty easy. He didn't have to take a lot of time off work. He just had to eat a bland diet for a little while, and then eventually he was just back to eating like normal.
After the procedure, my life's changed dramatically, professionally and at home. I don't have to think about acid reflux any longer when I'm active at work or at home and play with the family.
It's just been really nice to be together more as a family. We go for a lot more hikes and walks now. It's just really nice to see you enjoying life more.
I highly recommend the TIF procedure. I never dreamed I'd wake up one day without having to think about acid reflux or carry my little pills around with me everywhere I go. I don't know why I didn't do it sooner.
All surgical procedures have risks. Therefore, it is important to understand the associated risks. Before you decide on a procedure, speak to your physician in detail about the risks and complications that may occur. Expected risks or discomforts as a result of an endoscopic procedure include sore throat, left shoulder pain, temporary abdominal pain which can be treated with standard pain medication, temporary difficulty swallowing due to swelling, and nausea or vomiting. These expected events occur in more than 25% of people who have the TIF procedure. They are usually mild in severity and resolve themselves shortly after surgery. The TIF procedure may be right for you if you are at least 18 years old, have symptomatic chronic GERD, require and respond to pharmaceutical therapy, have a hiatal hernia less than or equal to 2 centimeters, and have a BMI less than 35. The TIF procedure may not be right for you if you have a bleeding disorder, chronic cough, stricture, severe esophagitis, esophageal diverticuli, an obstruction, a paraesophageal hernia, limited neck mobility, osteophytes of the spine, esophageal varices, esophageal infections or fungal disease, or esophageal stenosis. The procedure may not be right for you if you have anatomy that would prohibit insertion of the esophagus device, if you cannot adhere to the post-operative diet recommended for appropriate healing, are under 18 years old, have a hiatal hernia greater than 2 centimeters, have a BMI greater than 35, or are pregnant. Your physician may have other criteria he or she uses to determine whether you are an appropriate candidate. Ask your physician to discuss those criteria with you. To find a physician that offers TIF near you, visit gerdhelp.com. That's GERD help.com, and use the physician locator.